You may think that memory loss is simply a normal part of aging, but the truth is far more alarming. Many seniors are quietly slipping into rapid cognitive decline, not only because of age or disease, but because of the very medications they take every single day. Pills prescribed to help you sleep, ease your pain, control your bladder, or manage your heartburn may be silently rewiring your brain and accelerating dementia. I have seen patients who once handled finances, remembered names, and lived independently slowly become forgetful, disoriented, or unable to recognize family members, all while faithfully taking medications they believed were safe. What makes this even more dangerous is that these drugs are often considered routine or harmless. Yet, research shows that some of them directly interfere with brain chemicals essential for memory, attention, and clear thinking. The tragedy is that many seniors and their families never suspect the link. They assume confusion is just aging, when in reality, the culprit may be sitting right in the medicine cabinet. In this video, I will reveal 9 popular medications that every senior must watch out for, explain how they damage the brain, and share safer alternatives that can protect your memory. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you find this video valuable, type 1 in the comments. If not, type 0 so I know how to make better content for you. Part 1. Sleeping pills and sedatives, the silent memory erasers. The first group of medications you must be cautious about are sleeping pills and sedatives. Many seniors struggle with insomnia, anxiety, or restlessness, and doctors often prescribe medications like benzodiazepines or other sedative hypnotics to help calm the mind and induce sleep. At first, they seem like a miracle, allowing you to finally rest through the night. But the truth is that these drugs can silently erode your memory and accelerate dementia. Benzodiazepines, which include drugs like diazepam, lorazepam, and temazepam, work by enhancing the effect of a neurotransmitter called GABA, which slows down brain activity. While this calms anxiety and promotes sleep, it also interferes with the brain's ability to form new memories and maintain alertness. Long-term use has been linked in multiple studies to a higher risk of cognitive decline, confusion, and dementia in older adults. Patients may notice subtle changes at first, such as forgetting conversations, misplacing items, or feeling groggy in the morning. Over time, these symptoms can worsen into significant disorientation and dependency. Other sedative hypnotics, sometimes prescribed for sleep under names like zolpidem or ezopiclone, may also carry similar risks. They may not belong to the benzodiazepine family but act on the same brain pathways, producing short-term relief at the cost of long-term clarity. What makes these medications especially dangerous is that seniors are often prescribed them for months or even years, when most guidelines recommend only short-term use. The brain of an older adult is more sensitive to their effects, and the cumulative damage can be devastating. Families may assume their loved one's memory is fading naturally, when in fact the nightly pill is accelerating the process. Safer alternatives do exist. Non-drug strategies for sleep, such as maintaining a consistent bedtime routine, limiting caffeine, increasing daytime activity, and creating a quiet, dark sleeping environment, can be very effective. In cases where medication is necessary, doctors may consider short courses of milder agents and closely monitor for side effects. The key is to never stop or change medication on your own, but to have an open discussion with your doctor about the risks and possible alternatives. Remember, every pill you take interacts with your brain. And when it comes to sedatives, the price of nightly rest may be long-term memory loss. If this warning about sleeping pills surprised you, wait until you hear about the next group of drugs, which are even more common and often overlooked anticholinergic medications. The hidden brain blockers that quietly sabotage memory and attention. Part 2. Anticholinergic medications, blocking vital brain signals. The second group of medications that seniors must be especially cautious with are anticholinergic drugs. These medications are widely prescribed for conditions ranging from allergies and bladder problems to depression and even some stomach issues. At first glance, they may seem harmless, but the truth is they interfere directly with one of the brain's most vital chemical systems, acetylcholine. Acetylcholine is a neurotransmitter that plays a central role in memory, learning, and attention. It is also the very same chemical pathway that degenerates in Alzheimer's disease. When you take anticholinergic drugs, you block acetylcholine, reducing the ability of nerve cells in the brain to communicate effectively. For a younger person, the brain may compensate, but in seniors, where reserves are already lower, this blockage can lead to rapid memory decline, confusion, and in some cases, full-blown delirium. Examples of anticholinergic drugs include certain antihistamines like diphenhydramine, often found in over-the-counter sleep aids, medications for overactive bladder such as oxybutynin or totaraidine, and older antidepressants like amitriptyline. Many people do not even realize they are taking an anticholinergic because these drugs are present in dozens of common prescriptions and even in medications sold without a prescription. The danger is that their effects build quietly. At first, patients may notice they feel a little foggy or distracted. But over weeks and months, this can progress to profound memory loss and disorientation. Studies have shown that long-term use of strong anticholinergic drugs is linked to a significantly higher risk of dementia. And this risk grows with the number of anticholinergic medications a person takes. This means seniors who take multiple prescriptions are at the greatest danger, because the anticholinergic burden adds up silently. Families may notice that their loved one seems more confused after starting a new bladder pill or allergy medication, but they may dismiss it as stress or age. In reality, the drug may be accelerating brain decline. The good news is that safer alternatives are often available. For allergies, non-sedating antihistamines such as loratadine or cetirizine are far less anticholinergic. For bladder problems, newer medications or lifestyle strategies may help. And for depression or pain, modern antidepressants that do not block acetylcholine can be considered. The key is to ask your doctor to review all of your medications, including over-the-counter drugs, for anticholinergic effects. Never assume that because a drug is sold without a prescription, it is safe for long-term use in older adults. Protecting acetylcholine means protecting memory, focus, and independence. If this warning has opened your eyes, wait until you hear about the next group of medications, which millions of seniors rely on every spring and fall. Allergy drugs that seem harmless but can quietly suppress cognitive function. Part 3. Allergy drugs, the hidden cognitive suppressors. The third group of medications that deserve your attention are allergy drugs, especially the older generation antihistamines. Many seniors take them casually, sometimes daily, during allergy season or even at night to help them sleep. They are available over the counter. So people assume they are safe. But the truth is, these drugs can quietly suppress brain function and accelerate memory decline. First-generation antihistamines such as diphenhydramine and chlorpheniramine are well known to cross the blood-brain barrier. Once inside the brain, they not only block histamine receptors that regulate alertness, but also have strong anticholinergic effects, meaning they interfere with acetylcholine, the neurotransmitter essential for memory and concentration. The result is drowsiness, confusion, and in many seniors, a foggy state that can look like early dementia. Patients often describe feeling groggy in the morning, struggling to focus, or even forgetting conversations and appointments. Families sometimes notice sudden personality changes, irritability, or clumsiness that lead to falls. Over time, repeated use builds a dangerous pattern of cognitive suppression. Research confirms that long-term use of strong antihistamines is linked to higher dementia risk in older adults, where the brain is already more vulnerable. This effect is amplified. The tragedy is that many seniors take these drugs for years, unaware of the harm. Some even use them as nightly sleep aids because of their sedating effect, further compounding the damage. Safer alternatives do exist. Second-generation antihistamines like loratadine, cetirizine, and fexofenadine are much less likely to enter the brain and generally do not have significant anticholinergic activity. They control allergy symptoms without the same level of cognitive risk. For seniors with chronic allergies, working with a doctor to adjust medications or considering non-drug strategies like air filters, saline rinses, and lifestyle changes can also help. The key lesson is never to assume that an over-the-counter medication is harmless. Just because a pill is available without a prescription does not mean it is safe for long-term use in older adults. These hidden cognitive suppressors may feel like quick relief for sneezing or itching, but the real price may be long-term memory loss. Protecting your brain means being cautious with even the simplest medications in your cabinet. If this surprised you, wait until you hear about the next category, where medications prescribed for mood and emotional well-being, and not antidepressants, can sometimes backfire and lead to an even more dangerous kind of memory fog. Part 4. Antidepressants. When relief turns into memory fog. The fourth group of medications that seniors must approach with caution are antidepressants. These drugs are often prescribed to manage depression, anxiety, or chronic pain, conditions that are very common among older adults. At first, they can provide relief and improve quality of life. But the truth is that certain classes of antidepressants, especially the older ones, can cloud memory and contribute to rapid cognitive decline. The main culprits are the tricyclic antidepressants such as amitriptyline, imipramine, and doxepin. These medications have strong anticholinergic properties, which means they block acetylcholine, the very chemical your brain needs for memory, focus, and learning. By interfering with this system, tricyclic antidepressants can cause drowsiness, confusion, and long-term memory problems. Seniors who take them often describe feeling sluggish, forgetful, or unable to concentrate. Families sometimes notice that their loved one seems out of it or withdrawn, when in reality, the medication is interfering with brain function. Even some newer antidepressants can cause issues. Selective serotonin reuptake inhibitors, or SSRIs, are generally safer. But in some patients, they may still cause apathy, slowed thinking, or subtle cognitive changes, especially when combined with other medications. The danger grows when seniors are prescribed multiple drugs with overlapping side effects, creating a cocktail of memory fog. Research has shown that long-term use of anticholinergic antidepressants is linked to a significantly higher risk of dementia. This is especially concerning because depression itself is a known risk factor for cognitive decline, and adding a harmful medication can make the outcome worse. Yet many seniors are kept on these drugs for years without a proper review of whether they are still needed. Safer alternatives exist. For some patients, SSRIs or SNRIs may provide the needed relief with less impact on memory. Non-drug strategies such as counseling, cognitive behavioral therapy, exercise, and social engagement have also been shown to help reduce depression and improve brain health. The important step is to have medications reviewed regularly and to never assume that a prescription given years ago is still the best option today. Memory is too precious to sacrifice for relief when safer options are available. Seniors and their families should not hesitate to ask doctors if their antidepressant may be contributing to memory fog and whether an alternative exists. The lesson is clear. What begins as a treatment for emotional pain can sometimes end up damaging cognitive function if the wrong antidepressant is used or if it is taken for too long without review. If this warning has made you think, wait until you hear about the next group of drugs, which are some of the most commonly prescribed in the world, painkillers and opioids that not only dull the body but also slowly damage the mind. Part 5. Painkillers and opioids, dulling the body, damaging the mind. The fifth group of medications that seniors must treat with extreme caution are painkillers, particularly opioids. These drugs are often prescribed for chronic back pain, arthritis, or after surgery. At first, they seem like a blessing, bringing relief when nothing else works. But the truth is, they not only dull the body's pain but also damage the mind, accelerating memory decline and raising the risk of dementia. Opioids such as morphine, oxycodone, hydrocodone, and fentanyl work by binding to opioid receptors in the brain, dampening the sensation of pain. Yet these same pathways also affect mood, alertness, and cognition. In seniors, whose brains are already more sensitive, the effects can be devastating. Short-term use may cause drowsiness, slowed reaction time, and confusion. Long-term use has been shown to impair memory, reduce attention span, and in some cases trigger delirium, a sudden and severe state of mental confusion that can leave patients disoriented and frightened. Research has linked chronic opioid use to an increased risk of dementia. Part of this risk comes from the way opioids depress brain activity and interfere with oxygen levels, starving neurons of what they need to function. Another part comes from the sedation they cause, which reduces mental stimulation and leads to further cognitive decline. Patients often describe feeling like they are in a fog, unable to focus or remember details. Families may notice their loved one losing interest in conversation, forgetting simple tasks, or even experiencing dangerous falls due to impaired balance. The tragedy is that opioids are often prescribed for conditions that might be managed in safer ways. Non-opioid pain relievers, physical therapy, exercise, heat and cold therapy, or targeted injections may provide relief without damaging memory. Even when opioids are necessary, they should be used for the shortest possible duration and at the lowest effective dose. with constant review from a doctor. Seniors must also be cautious about combining opioids with other sedating drugs like sleeping pills, which multiplies the risk of memory loss and even respiratory failure. The key message is clear. Pain relief is important, but the cost should never be your independence, your clarity, or your memories. If you or a loved one are relying on opioids long-term, speak with your doctor about alternatives and strategies to reduce reliance. Protecting your brain must always be part of the pain management plan. If this warning has caught your attention, wait until you hear about the next group of medications, which are surprisingly common in seniors seeking relief from bladder problems. These bladder control drugs promise convenience, but often trade it for rapid memory decline. Part 6. Bladder control medications. Trading convenience for cognition. The sixth group of medications that seniors must handle with caution are bladder control drugs. These medications are often prescribed to manage overactive bladder, urinary urgency, or incontinence. For many seniors, the embarrassment and inconvenience of bladder problems can be overwhelming, and doctors may offer medications like oxybutynin, tolterodine, or sulfonylurea to help. At first, these drugs seem like a solution, restoring dignity and freedom, but the hidden truth is that they can severely damage memory and accelerate dementia. Bladder control medications belong to a class of drugs with strong anticholinergic properties. They work by blocking acetylcholine receptors in the bladder, relaxing the muscles and reducing the urge to urinate. Unfortunately, they also block acetylcholine in the brain. This is a devastating trait, because acetylcholine is critical for learning, focus, and memory. By reducing its activity, these drugs create a chemical state in the brain similar to that seen in Alzheimer's disease. Seniors who take them may notice confusion, forgetfulness, or difficulty concentrating. Families may see their loved one become withdrawn, irritable, or disoriented. What is most alarming is how quickly these changes can appear. Even short-term use can trigger noticeable memory problems, and long-term use is strongly linked to dementia. Research has confirmed that seniors taking bladder anticholinergics for months or years have a significantly higher risk of rapid cognitive decline. The damage is often mistaken for natural aging, when in reality it is medication-induced. The tragedy is that bladder problems, while distressing, are not life-threatening. But the cognitive cost of these drugs can steal independence and identity. Safer options do exist. Lifestyle strategies such as bladder training, pelvic floor exercises, limiting caffeine and alcohol, and managing fluid intake can all reduce symptoms without harming the brain. Newer medications with less anticholinergic activity may also be considered. The most important step is for seniors and their families to ask their doctor to review whether bladder medications are truly necessary and whether alternatives exist. No one should sacrifice memory and clarity just to visit the bathroom less often. Protecting the brain must always take priority. The lesson is clear. Trading convenience for cognition is never worth it. If this warning about bladder drugs has shocked you, wait until you hear about the next group of medications, which millions of seniors take daily for digestive comfort, heartburn, and acid reflux drugs that may seem harmless but carry unexpected risks for the brain. Part 7. Heartburn and acid reflux drugs, unexpected brain risks. The seventh group of medications that seniors must treat with caution are the drugs commonly used to control heartburn and acid reflux. These medications, known as proton pump inhibitors, such as omeprazole, pantoprazole, and esomeprazole, or H2 blockers like ranitidine and famotidine, are among the most widely prescribed in the world. Many people take them daily for months or even years to relieve discomfort after meals or to manage gastroesophageal reflux disease. At first glance, they seem harmless, even protective. But the truth is that long-term use has been linked to serious brain risks, including memory loss and increased dementia risk. Proton pump inhibitors work by reducing the stomach's production of acid. While this helps with reflux symptoms, it also interferes with nutrient absorption, especially vitamin B12 and magnesium, both of which are essential for brain function. Vitamin B12 deficiency in particular is known to cause confusion, memory problems, and even permanent neurological damage if left untreated. Studies have shown that seniors who use proton pump inhibitors long-term are more likely to develop cognitive decline compared to those who do not. The exact reasons are still being studied, but several theories exist. Reduced absorption of critical nutrients, changes in gut bacteria that influence brain health, and direct effects on blood vessels all appear to play a role. Patients may begin to notice subtle symptoms such as brain fog, difficulty remembering names, or a loss of focus. Over time, these issues can worsen and mimic the early stages of dementia. Another hidden danger is that many seniors take these medications without regular medical review. What was meant to be a short course of treatment becomes years of daily use, with no reassessment of whether the drug is still needed. This silent dependency increases the risk of harm. Safer strategies do exist. Lifestyle changes such as avoiding late-night meals, reducing alcohol and caffeine, losing excess weight, and elevating the head of the bed can all reduce reflux symptoms. For many seniors, these changes may allow them to taper off or use the lowest possible dose of acid-reducing medication. Regular monitoring of vitamin B12 and magnesium levels is also crucial for those who must remain on these drugs. The lesson is clear. Relief from heartburn should never come at the cost of your memory and independence. If you or a loved one are taking reflux medications long-term, it is essential to review the risks with your doctor and explore safer options. If this has surprised you, wait until you hear about the next group of drugs, which many seniors rely on for blood pressure control. While these medications protect the heart, some of them may carry unintended consequences for the brain. Part 8. Blood pressure medications, protecting the heart but harming memory. The 8th group of medications that deserve careful attention are those prescribed to control high blood pressure. Hypertension is one of the most dangerous risk factors for stroke, heart attack, and kidney disease. So treating it is critical. Millions of seniors take blood pressure medications every day, often more than one. These drugs save lives by reducing the strain on blood vessels and protecting the heart. But the truth is that some of them may also harm memory and increase the risk of dementia, especially when used without close monitoring. Certain classes of blood pressure medications, particularly beta blockers like propranolol, atenolol, or metoprolol, can cross into the brain and slow down activity in areas that regulate attention and memory. Patients sometimes describe feeling mentally sluggish, finged, or unable to focus after starting them. In seniors, whose brains are already more sensitive, these effects can be magnified. Some diuretics, used to lower blood pressure by reducing fluid in the body, can cause low sodium or potassium levels. Electrolyte imbalances disrupt the electrical activity of brain cells, leading to confusion, dizziness, or even delirium in severe cases. Studies have shown that seniors on certain blood pressure medications have a slightly increased risk of cognitive decline, though the relationship is complex. The danger is not the treatment of hypertension itself, which is essential, but the choice and management of the medication. Uncontrolled high blood pressure is a major cause of dementia and stroke. So, stopping medication is never the answer. Instead, the goal is to work with a doctor to find the safest drug or combination for each individual. Some blood pressure medications may even protect the brain. For example, ACE inhibitors and ARBs have been shown in some studies to reduce dementia risk by improving blood flow and reducing vascular damage. This makes it vital for seniors to have regular reviews of their prescriptions. If one drug causes brain fog or memory issues, alternatives are usually available. Lifestyle measures such as reducing salt intake, exercising regularly, managing stress, and maintaining a healthy weight can also lower blood pressure naturally, reducing the need for higher doses of medication. The key message is balance. Protecting the heart should not come at the expense of the brain. If you notice confusion, memory problems, or unusual fatigue after starting or changing a blood pressure medication, report it immediately. Adjusting the dose or switching to a different drug can often resolve the problem. The lesson is clear. Blood pressure must be controlled to protect life, but the medications chosen must also protect memory and independence. If this reality has surprised you, wait until you hear about the final group of drugs, which millions of seniors take to lower cholesterol. These statins promise to protect the heart, but are surrounded by controversy over their effects on memory. Part 9. Statins and cholesterol drugs, controversy and cognition decline. The ninth and final group of medications that seniors must understand are statins and other cholesterol-lowering drugs. These are among the most commonly prescribed medications in the world. Millions of seniors take them daily to protect the heart and reduce the risk of stroke. Statins such as atorvastatin, simvastatin, and rosuvastatin work by blocking the liver's production of cholesterol, lowering blood levels, and reducing plaque buildup in arteries. At first glance, this sounds like a perfect solution, but the truth is more complicated. While statins can save lives by preventing heart attacks and strokes, there has been growing concern and controversy about their impact on the brain. Some patients report memory loss, confusion, or a foggy feeling after starting statins. Research studies have produced mixed results, with some showing a link between statins and cognitive decline, while others suggest that statins may even protect against dementia by improving blood vessel health. The reality likely depends on the individual. Statins reduce cholesterol throughout the body, and cholesterol is not only important for the heart, but also for the brain. Your brain is the most cholesterol-rich organ in the body, and it relies on cholesterol for building nerve cell membranes and producing key signaling molecules. In some sensitive individuals, lowering cholesterol too aggressively may disrupt these processes and affect memory. Seniors may notice difficulty recalling names, forgetting recent events, or struggling with focus after beginning a statin. Families sometimes describe their loved one as being not themselves, more withdrawn or less sharp. For others, statins may not cause any noticeable cognitive problems at all. The danger comes when these side effects are dismissed as normal aging rather than recognized as potential drug-related issues. The good news is that not all statins affect the brain equally. Some, like pravastatin, are less likely to cross into the brain and may carry lower risk in cases where memory issues arise. Switching to a different statin, adjusting the dose, or combining lifestyle changes with medication may resolve the problem. Seniors must not stop cholesterol medications suddenly, as this can sharply increase the risk of stroke and heart attack. Instead, they should have an open discussion with their doctor about the balance of risks and benefits. Lifestyle strategies like a diet rich in fruits, vegetables, and whole grains, regular physical activity, and weight control can also lower cholesterol naturally and reduce reliance on high-dose medication. The lesson is clear. Statins and cholesterol drugs protect the heart, but they are not without controversy when it comes to memory. Every senior must be aware. Monitor their cognition closely and work with their doctor to find the safest and most effective plan. Now that you know all 9 groups of medications that can accelerate dementia, the final step is to bring these lessons together and understand how awareness, communication, and prevention can safeguard both heart and brain. Conclusion: protecting memory while managing medications. We have now reached the conclusion, and the message could not be clearer. Medications are powerful tools that can heal, but they can also harm when their effects on the brain are overlooked. Throughout this video, we uncovered 9 groups of commonly used drugs that may trigger rapid dementia: sleeping pills and sedatives, anticholinergic medications, allergy drugs, antidepressants, painkillers and opioids, bladder control drugs, acid reflux treatments, blood pressure medications, and cholesterol-lowering statins. Each of these was designed to treat a problem, yet in seniors, they can also interfere with memory, focus, and independence. The danger is that the signs of medication-induced cognitive decline often mimic aging itself. Families assume forgetfulness or confusion is inevitable, when in truth, it may be reversible if the right changes are made. The tragedy is that many seniors lose years of clear thinking because no one connected their memory problems to the pills in their cabinet. But there is hope. Protecting memory while managing health conditions is possible. The key is awareness and vigilance. Seniors and their families must regularly review every medication with their doctor, including over-the-counter drugs. Ask specifically whether any of them have anticholinergic effects or are known to affect cognition. If memory issues appear, do not dismiss them. Speak up immediately, because alternatives often exist. Safer drugs, lifestyle adjustments, or lower doses may provide the same relief without sacrificing brain health. Non-drug strategies should never be underestimated. Sleep hygiene, exercise, balanced nutrition, stress management, and social engagement are proven to improve both physical health and cognitive resilience. In many cases, they can reduce reliance on high-risk medications altogether. The lesson is that your brain is precious, and it deserves protection just as much as your heart, lungs, or bones. Seniors must demand care that treats the whole person, not just one symptom at the expense of another. Your body still remembers how to heal, and your brain can remain strong if you take the right steps today. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward healthier living and sharper minds. If you found this video valuable, comment 1. If not, comment 0, so I can improve. And do not forget to like, share, and subscribe so you never miss another health tip made just for you. Share this video with someone you love, because the knowledge you pass on may protect their memory and preserve their independence.